Negative. So very good evening, all of you. So kindly confirm in the chat box if I'm audible now. I had a Small technical difficulty. Yeah, I guess right now it's audible, right? I'll just reconfirm and then I'll start the session. Okay, fine. Thank you so much for confirming. So, myself, I'm Dr. Jazeer, your dermatology faculty at PW MedEd. So, welcome to this session of MedEd Clinics, where I would be discussing some of the very important clinical science in dermatology with all of you. We had a delayed start today because there's a saying that difficult road often leads to beautiful destinations, isn't it? So sometimes in life, difficulties do happen, be it technical difficulty or anything else. But yes, once we approach it positively, anything is manageable. So now what I'm intending to do in today's session is that I'm trying to introduce you a lot of clinical science that you may see once you go for your postings in dermatology, isn't it? Because dermatology, this department, where in your medical education, in your MBBS days, you will be having a very short posting, and that is the reason why you may feel that during this very short period of time, you may find a lot of difficulty that you may not be able to identify the diseases. You may not able to reach out to the spot diagnosis. You may be not understanding what should be my approach to diagnosing these diseases when it comes to uh, the management of these dermatological cases in your OPD, isn't it? So this is going to be the most common problem that is faced by any MBBS student. So this, by MedEd clinics, what we are trying to sort out is that whenever you have your postings, be it in any subject, now talking very specifically about dermatology, you should be able to understand how do you approach various kind of diseases in dermatology. So in today's session, I would like to start with the important clinical signs in dermatology. Now, why did I choose this topic called as clinical science in dermatology? Is because when you are becoming a physician, a clinician, you should be having this skill, which is called as very good observation, isn't it? So you should be able to be a very good observer. Only then you will be able to understand ki ha, this finding can be related to this disease. This finding can be related to this disease. So what should pick up the signs? Our eyes should be able to pick up the signs, right? So when our eyes is able to pick up the signs, there is a saying that the eyes cannot see what the mind doesn't know. So this is a wonderful saying which says that the eyes cannot see what the mind doesn't know. So it is very, very important that we train what first? We should be training our minds first so that our eyes will start picking up all those diseases, isn't it? So what we'll try to do is we'll try to train our minds in such a way that when you go to the OPD, you'll be able to pick up all those things with your eyes, and that is how you can diagnose various diseases. You'll be able to reach out to a lot of diagnoses, a lot of differential diagnosis, etc. Okay, so without wasting much more time, so now let us move into and see what are the common dermatological signs which you can see in the OPD. Now, when I start with the first one, what I'm trying to do here is, so I'll just move to the slide. So what I'll be trying to do here is, I'll just help you to describe the sign. Now, what I would love is, in case you are able to guess what is the name of the sign, that would be very great because that would make the session much more interactive. And if you have any queries, please feel free to drop your queries in the chat box. Okay? So now let's see. A new skin lesion appears on a healthy skin after an injury. Guess the sign. Now, what I would like all of you to do is just see that this is how a patient is coming to your OPD. Now, you can see that there is some lesions over the skin, isn't it? So when you see these lesions over the skin, just trying to apply some of the common sense here. What would be the trauma that we are talking about here, isn't it? Any guess what would be the trauma that I'm talking about? So in the simplest answer here is, when you see this image of the skin, can you just try to imagine that somebody has scratched over the skin? Okay, scratching over the skin is considered to be a trauma, isn't it? So once you scratch over the skin and the patient develops new skin lesions at the site of trauma, this is called as a phenomenon. It is called as Koebner sign. Okay, this is called as Koebner sign. So in this image, what is the trauma? Okay, rather than injury, I would like to keep it as trauma. Okay, so new skin lesions developing at the site of trauma. And here, what is a trauma in this image? This may be due to scratching over the skin. Scratching over the skin. So this is called as Koebner's phenomenon. Now, what are the diseases? Now, what you need to remember is you need to remember some of the diseases where this kind of a phenomenon can be seen. Now, please try to remember it as LVP. Now, what is L? L stands for lichen planus. V stands for vitiligo. And P stands for psoriasis. So remember these very common diseases where you can find that a patient is developing new skin lesions at the site of trauma. Now, how you have to visualize this is that this image is actually an image of psoriasis. The reason why I say is because here you can see plaque lesions. Okay, so in case you have seen a patch lesion, in case this is going to be a whitish patch, okay, just like this, like this, like this, all these are going to be a whitish patch. Then whenever you see a depigmented skin lesion which is appearing at the site of trauma, which of the following diseases can it become? So among all these things, is it lichen planus, is it vitiligo, or is it psoriasis? It is most likely to be vitiligo, right? Vitiligo. Why vitiligo? Because in vitiligo, you can see depigmented skin lesions. So this is a very, very important dermatological sign that you have to remember. It's called as the Koebner sign. So some textbooks also mention it as isomorphic phenomenon. So some textbooks also mention this sign as isomorphic phenomenon. Okay? So that is about Koebner sign. So please remember. Now, what are the types of trauma that can happen to our skin? What are the types of trauma? Let me say that in case I got a small injury and I had to get a small suturing done, is it considered to be a trauma? Yes. So in these patients who is having lichen planus, vitiligo or psoriasis, whenever there is an injury or a trauma, whatever it is, at the site of the injury or at the site of the trauma, if a patient develops new skin lesions, that is called as Koebner. So I hope this is very clear to all of you. So with your permission, let me just go to the next sign. अब तो हो गया Koebner phenomenon. So now we are going to discuss about something else very similar to what we have learned now. So this one I would call as Pseudo-Koebner phenomenon. So what is Pseudo-Koebner phenomenon? So Pseudo-Koebner, remember what is the other name of Koebner phenomenon I mentioned to you just now? अभी बताया था. So Koebner was also called as isomorphic, है ना? तो pseudo Koebner को हम pseudo isomorphic कहते हैं. Pseudo isomorphic phenomenon. So this is the name of pseudo Koebner phenomenon. Now let us try to understand कि pseudo Koebner phenomenon क्या होता है. Okay, so now just read out the sentence. A new lesion is developing due to auto-inoculation of the virus. Okay, due to auto-inoculation of the virus. So imagine कि very good Kalai, you're answering it right. This is called as pseudo-Koebner. Now just see this image. Now इस image में कौन सा disease का image है ये एक spot diagnosis है. You see this image, you should be able to tell कि diagnosis क्या है. Can anybody tell me what is the diagnosis of this image? So the diagnosis of this image, ये जो एक spotter है, very common in children. सो ये स्पॉटर है मोलस्कम कंटेजियोसम का, मोलस्कम कंटेजियोसम. Now, what is happening in molluscum contagiosum? Molluscum contagiosum, very good, Kalai. So this is molluscum contagiosum. So in molluscum contagiosum, why do you say this is molluscum contagiosum? Because if I zoom this image, whenever you find a small papular lesion along with a central umbilication, ये जो डिप्रेशन है जो सेंटर में दिखते हैं है ना, ये जो डिप्रेशन, दिस इज कॉल्ड एज सेंट्रल अम्बिलिकेशन. सो व्हेनेवर यू फाइंड अ लीशन विद अ सेंट्रल अम्बिलिकेशन, द डायग्नोसिस इज मोलस्कम कंटेजियोसम. अब मोलस्कम कंटेजियोसम क्या है? इज इट अ बैक्टीरियल डिजीज, or is it a viral infection, or is it a fungal infection, or is it an autoimmune disease? Now what is molluscum contagiosum? This is a viral infection. So this is a viral infection. So just imagine कि a child has come to your OPD, okay, or in the OPD you can see these kind of lesions in the trunk of a child. फेस में हो सकता है, नेक में हो सकता है, ट्रंक में हो सकता है, कहीं पे भी हो सकता है ना. सो इफ यू सी दिस काइंड ऑफ ए लीशन, तो इन वन गो आपको पता चला कि ये मोलस्कम कंटेजियोसम है, ये वायरल डिजीज है. सो व्हेनेवर वी गेट एनी लीशन इन आवर स्किन, हमारा यूजुअल टेंडेंसी क्या होता है? जैसे आपको एक एक्नी का लीशन आ गया, पिंपल आ गया, तो वी आर ऑलवेज हैविंग दिस फीलिंग कि ओके बार बार हम ये पिक करते हैं या फिर टच करते हैं, isn't it? Similarly, when a child develops molluscum contagiosum, the child will always touch this lesion. ये टच करने के बाद क्या होता कि adjacent skin में also they will touch. So when they touch the adjacent skin, so अगर this is the first lesion to develop, in some time the second lesion also develops. ये हो गया second lesion. So because of touching the lesion and touching the normal skin, so this virus goes from here to here. So ये हो गया third lesion, फिर हो गया fourth lesion. So one lesion is appearing one after the other. Why does it appear? Because of auto-inoculation of the virus. So that is why this is called as Pseudo-Koebner phenomenon. So this is called as Pseudo-Koebner phenomenon. And please remember कि कौन से diseases में आपको Pseudo-Koebner देखने को मिलता है ना. सो ऑल दीज थिंग्स शुड बी वायरल डिजीजेस, जैसे हो गया मोलस्कम कंटेजियोसम वायरस या फिर वायरल वाट्स, है ना, वायरल वाट्स. सो व्हाट इज द कॉजेटिव ऑर्गेनिज्म ऑफ वाट्स? जैसे मोलस्कम कंटेजियोसम इज कॉज्ड ड्यू टू पॉक्स वायरस, सो दिस इज मोस्ट कॉमनली ड्यू टू MCV1. पर यहाँ पे वाट्स जो है ना, व्हाट इज वाट्स? वाट्स इज यूजुअली कॉज्ड ड्यू टू ह्यूमन पैपिलोमा वायरस इन्फेक्शंस, human papilloma virus infections. So that is about Pseudo-Koebner phenomenon. Clear? So now let me go through the next kind of a sign. So why am I teaching you all these signs? Is because these signs, they come to you. Okay, patient will never tell you that I developed this lesion after trauma. Kabhi nahi, isn't it? Signs are elicited by the physician, isn't it? So similarly, Pseudo-Koebner also, the patient is not going to tell that मैंने यहाँ पे टच किया, टच करने के बाद यहाँ टच किया और फिर हर जगह पे ये lesions आ गया. They will never say this way. So that is why I said you have to be a good clinician to see these signs in the skin and make your own inference. ठीक है? So now let's see this next finding. This is a very, very important thing for your exam, be it for practicals, be it for Viva. So this is a very, very important clinical sign, that too seen in a disease called psoriasis. Now let's read the sign. Punctate bleeding spots when the psoriasis scales are scraped off. Identify the sign. So can anybody identify this sign in the chat box? Because if you have gone to the clinics, if you have learned some theory, this is something which you would have definitely done. So this one, what you can see in psoriasis, the name of this sign is called as Auspitz sign. Auspitz sign. Okay. Now what is Auspitz sign? Now in case this is a patient who is having a psoriatic plaque lesion. So psoriasis mein, how is the plaque lesion usually? Yes, doctor, very good. So you are answering it as grattage. Excellent. So we call it as a Grettage test as well. The sign here is called as Auspitz sign. So what is this Grettage test? So ये जो Grettage test है, we take a glass slide, ठीक है? So once we take a glass slide and we try here, no doctor, Auspitz and Grettage is not going to be the same. I'm just explaining you कि difference क्या होता है, ठीक है? So this test called as Grettage test in a psoriasis patient, if you take a glass slide, okay? तो when you take a glass slide और ये lesions के ऊपर आप scrape कर रहे हो, okay? You are gonna scrape over the lesions. Then what happens is accentuation of the scales on scraping the lesion is called Grettage test. तो first क्या होगा, ये जो scales आप देख रहे हो, okay, all those, I'll just change the color, one moment. So all these whitish color things that you can see, okay, all these white lesions, these are called as a scaling, right? So when you repeatedly, when you start scraping the lesion, क्या होगा, the scales become very much visible to your eyes. That is what we call as accentuation of the scaling. This is called as Grettage test. अभी आप Grettage test करते रहो. Once you continuously do this Grettage test, या फिर scraping over the lesion, फिर क्या होगा, all these scales are going to disappear. So all this scaling is going to now disappear. Now ये disappear होके अभी यहाँ पे center में आपको ये दिख रहा है that the entire scaling has disappeared. Now the scaling has disappeared और यहाँ पे आपको देखने के लिए मिलेंगे ऐसा small pinpointed bleeding spots. So when you can see these kind of pinpointed bleeding spots, this is called as Auspitz sign. This is called as Auspitz sign. Abhi Kalai is adding one more very important thing. I'm so happy that you're able to add these points now. Now, what is Kalai adding to the chat box now? She has mentioned something called as Bulkley's membrane. Now, what is this Bulkley's membrane? So in Bulkley's membrane, what is happening is, just imagine कि I am giving you a glass slide. आप ये lesions के ऊपर scrape कर रहे हो. So initially when you scrape over the lesions, what do you see? You can see that there is a accentuation of the scaling. Scaling काफी visible हो रहा है. Now once you continue doing the scraping over the lesions, then what happens? A shiny membrane, a very shiny membrane appears. So this shiny membrane that appears, this is called as Bulkley's membrane. Now again, you are not stopping. Now you are going to continuously scrape over the lesion. Once you continuously scrape over the lesion, you see this bleeding spots, and this is called as Auspitz sign. Very important clinical sign for all of you, even during your dermatology postings or during your internship, or whenever you get to see a patient of psoriasis. So please remember, this is called as Auspitz sign. Shall I move to the next one? So now moving to the next one. Now all of you just see this patient. Abhi bas don't read anything about whatever I have mentioned about the skin sign. Just see this patient and just tell me कि क्या हो सकता है diagnosis. I'm not giving you any clue. Just seeing this skin of a patient. What could be the diagnosis in this patient? What could be the diagnosis? Any common things that comes to your mind, just try to say to yourself कि हाँ ये ऐसा patient हो सकता है, all those things. So any differential diagnosis that comes to your mind when you see this image? So I would say this can be a burns patient, है ना? So this can be a burns patient, या फिर this should be a patient who is having some vesiculobullous disease. Now let us see, having this perception in your mind, now let us read what is the sign. Patient presented with a skin finding in which the top layers of the skin, they slip away from the lower layers when rubbed. Okay. Otherwise, I can just frame the sentence in such a way that skin peels off on tangential pressure. Skin peels off on tangential pressure. Very good, Kalai. This is the right answer. So this one is called as Nikolsky sign. Okay, this is called as Nikolsky sign. Now, whenever, what I would advise you is, whenever you see a patient who has developed a bulla, जैसे burns के बाद क्या होता है, burn injury या scalding के बाद, the patient can come to you with multiple bulla over the skin, है ना? So what is a bulla? A bulla means that is a lesion, something which may look like this, which contains a clear fluid. So this is a raised lesion which contains a clear fluid. Now what happens when a bulla would rupture? एक bulla था इधर, this bulla is ruptured. Now what you see here is a erosion. Now if I apply a tangential pressure like this in this direction over the normal skin. So when I apply a pressure over a normal skin यहाँ पे, then what happens? The skin may peel off. This is called as Nikolsky sign. So Nikolsky sign also, please try to remember which are the diseases where you can see a Nikolsky sign positive. Of course, you can see Nikolsky sign in burns, isn't it? You can also see a Nikolsky sign in vesiculobullous diseases. Can anybody give me an example of a vesiculobullous disease जहाँ पे आप Nikolsky sign देख सकते हो? मतलब नॉर्मल स्किन के ऊपर जब आप टेंजेंशियल प्रेशर डालते हो, द एंटायर स्किन में पील ऑफ. सो एनी एग्जांपल, जस्ट गिव इट अ ट्राई. कोई भी वेसिकुलोबुलस डिजीज, ऑटो इम्यून वेसिकुलोबुलस डिजीज, ये सब आपके लिए क्लूज है. ओके, सो हियर द अनदर एग्जांपल शुड बी पेम्फिगस. ठीक है, प्लीज ट्राई टू रिमेंबर पेम्फिगस. सो पेम्फिगस foliaceus, pemphigus vulgaris. All these diseases can show a sign called as Nikolsky sign. And there is one more disease where a child who was not treated properly on time and because of staphylococcal toxins can also present to you with these kind of skin lesions. It just presents to you like a burns patient. So any option, any idea? So very good, pemphigus group of disorders is good. Now what is the last example that you can add here? A child, excellent. So this is called as 4S. This is called as 4S. So very glad to see this answer in the chat box. Now what is 4S? 4S means staphylococcal scalded skin syndrome. Staphylococcal scalded skin syndrome. So this is another disease where you can find this Nikolsky sign positive. This is where you can find this Nikolsky sign positive. So please remember all those things. Now let me just move to the next one. So moving to the next one, what do you see here? Now ये थोड़ा interesting है क्योंकि अभी just few minutes back when I talked about Nikolsky sign, क्या हुआ था? Bulla was not there. The bulla had ruptured and then we were applying a pressure and then we were seeing that the skin was peeling off. अभी आप imagine करो कि एक patient है who has come to you with a very tense bulla. Okay, very strong and a very tense bulla. And this bulla is not breaking easily. जैसे if I apply a tangential pressure over the normal skin, यहाँ पे nothing is happening. Bulla is the same. So यहाँ पे तो Nikolsky is negative. So यहाँ पे Nikolsky is going to be negative. But what is happening? I'm just applying a pressure over the adjacent skin. Okay, surrounding skin में मैं pressure डाल रहा हूँ. And when I apply a pressure towards this direction, what is happening? The bulla is also moving towards this direction. The bulla is also moving towards this direction. So can you name the name of the sign now? I'm applying a pressure over the surrounding skin and the bulla, I can move the bulla now. So this is called as Asboe-Hansen sign. So this one is called as Asboe-Hansen sign. And when can you find a positive Asboe-Hansen sign? Can you see a Asboe-Hansen sign in a disease where the bulla can break very easily, जैसे burns, जैसे pemphigus vulgaris, pemphigus foliaceus. In all those cases क्या हो रहा था? The bulla was breaking so easily. So इसीलिए even if you apply a pressure from here, the bulla is already ruptured. आपको ये बुल्ला Asboe-Hansen sign demonstrate नहीं कर पाओगे. Now instead, when I come to this image, if there is a tense bulla, for example, in diseases like bullous pemphigoid. So in diseases like bullous pemphigoid, you can see this sign which is called as Asboe-Hansen sign. Asboe-Hansen sign. तो काफी सारे डिजीजेस हैं जहां पे आप टेंस बुल्ला देख सकते हो, जैसे लीनियर आईजीए डिजीज, लीनियर आईजीए डिजीज. तो इन विच एवर केसेस जब आपको एक टेंस बुल्ला देखने के लिए मिलेंगे, उस केसेस में आप एस्बो-हैंसन साइन आप डेमोन्स्ट्रेट करके चेक कर सकते हो. ठीक है. सो दैट इज अबाउट एस्बो-हैंसन साइन. So now let's move to the next one. Now what is this? Now this is a patient who has come to you, and the patient is telling you that every time when you stroke over the skin of the patient is observing some reaction like this. Now let me explain to you once again. Like I'm taking a pen or a pencil and I am just going to rub over the skin of a patient. So once I stroke over the skin of a patient, what happens? The patient is developing a flare reaction, isn't it? The patient can develop a urticarial wheals. So some edema develops underneath the skin. There is some redness which has developed here. So this one is called as, would you like to give it a guess? Because in the sign itself I have mentioned this is seen in cutaneous mastocytosis, I mean systemic mastocytosis, or urticaria pigmentosa. So the name of the sign is called as Darier sign. The name of the sign is called as Darier sign. So what is Darier sign? In a patient who is having mastocytosis, there is a lot of mast cell degeneration that is happening. So because of that, this is a patient who is coming to you saying that I'm having so much of itching over my skin and I also develop some urticaria. Urticaria matlab some edema underneath the skin. So in those kind of patients, when you just stroke over the skin, the stroking over the skin produces urticarial lesions. Stroking over the skin produces urticarial wheals. This is called as Darier sign. So what you will remember is, whenever you see this kind of a reaction, this is called as Darier sign. And in which disease do you see Darier sign? This can be seen in a disease called as urticaria pigmentosa or mastocytosis. Urticaria pigmentosa या फिर mastocytosis. So now let's move to the next sign now. Now, whenever you go to the dermatology OPD, काफी सारे ऐसे केसेस देखने को मिलता है जहाँ पे the patient will say कि when I take something जैसे सी फूड ले लिया या फिर फ्रूट जूसेस ले लिया या फिर they went to a park to play for some time, तो वापस आने के बाद what they do, they develop a lot of itching and some urticarial wheals in the body. So these are a group of diseases which we can categorize it as urticaria. Now in those kind of patients who is having urticaria, there is a very, very important phenomenon of the skin which we call it as dermographism. A very important clinical sign which is called as dermographism. Now what is dermographism? Let us try to understand what is dermographism. After scratching or stroking with the pointed objects, the patient may develop inflamed lines in the same pattern how you have stroke over the skin. Okay, just if I'm taking this same pen, I'm taking the same example now. I just use my pen to stroke over the patient in this manner. Okay, I have stroked over the skin in this manner. Now after stroking over the skin, what has happened? I just wait for a couple of minutes. After a couple of minutes, what do I get to see? I get to see that the patient has developed something like this over the skin. Like wherever I have stroke over the skin, the same site may the patient has developed a urticarial wheal. The patient has developed an urticarial wheal. This phenomenon is called as dermographism, isn't it? So this phenomenon, yeah, this is an exaggerated wheal frail response. Excellent. Now, in which condition can you see this kind of dermographism? वो काफी important है क्योंकि most of the cases में acute urticaria में we don't see. We usually see this in cases of chronic urticaria. So we see this in cases of chronic urticaria. Okay. So the easiest way how can we demonstrate this sign in the OPD is when the patient is sitting in front of you, you just ask the patient to show their forearm, and then you just take a pen, I mean a pointed object, be it a key or something, and then just draw a line like this with the keys. Okay, and then just wait for a couple of minutes. So in a couple of minutes, what happens if the patient develops a linear urticarial lesion just over how you have stroked over the skin? So when you see these kind of nodular lesions, you always would suspect nodular lesions. You always would suspect. So what do you suspect in those cases? So you may suspect genodermatosis, which is called as neurofibromatosis. Now in this neurofibromatosis, there is a sign, that is a presence of axillary freckling in a patient with neurofibromatosis. What is the name of the sign? Very, very good. So this sign is called as Crowe sign. Excellent. So happy to get this answer in the chat box. So this is called as a Crowe sign. Now what do you mean by a Crowe sign? So Crowe sign means there is axillary freckling. So let us try to understand what exactly is freckles. See, in patients who are having a very fair complexion, okay, very white skin. So in those patients, you can see multiple brownish spots over the sun exposed areas, just a face, neck, over the forearms, over the arms and all. So this is called as freckles. Now here what do you find is you can find axillary freckles. Here you can find axillary freckles. Now what is this axillary freckles? I'll just zoom this image for you. Can your eyes see multiple brownish spots over the skin? These kind of brownish spots that you can see over the axilla, these kind of brownish spots are called as axillary freckling, and this is seen in neurofibromatosis. And why is this sign very important for you? Because this sign is actually the hallmark of neurofibromatosis. So this sign is the hallmark of neurofibromatosis. That is why we call this sign by the name Crowe sign. So please remember, brownish macules seen over the axilla. So when you see these kind of brown colored macules over the axilla, always suspect it's a typical sign, hallmark of neurofibromatosis. Now neurofibromatosis you must have learned in medicine as well. You will also touch this topic in dermatology as well, because this is a disease which is autosomal dominant in inheritance, isn't it? This is a disease which is autosomal dominant in inheritance, and this has multiple skin features, out of which one of the most important feature that we discussed today is the Crowe sign. So now let's go to the next one. So in this next one, what am I mentioning here? Pinching the skin adjacent to a dermatofibroma causes a dimpled appearance on the skin. Does anybody know what is this one? Now what am I doing here? I'm just pinching. So let me give you an example. There is a trauma, or there has been an incident where you got an insect bite. Okay. And after getting an insect bite, if you're developing a solitary nodule, like there is a single lesion which you develop after an insect bite. So this can be a dermatofibroma. Hai na? So in this dermatofibroma, once I'm going to pinch on both just around this lesion, then what happens? What is happening is the lesion is going inside the skin, या फिर beneath the skin. So when the lesion is going beneath the skin, that is because the lesion is tightly attached to the subcutaneous layer. Since the lesion is tightly attached to the subcutaneous layer, excellent. So why do you have a question mark in the chat box? This is dimple sign. Okay, this is called as dimple sign. So I'm sure that all of you know what's a dimple. है ना, ये जो dimple है. So this is called as dimpled sign because whenever you are going to pinch on the adjacent part of the lesion, this lesion is going beneath the skin. And there is a dimpling over the skin. That is why we call it as dimple sign. Please remember, this sign is also called as Fitzpatrick sign. So this sign is also called as Fitzpatrick sign. Okay? So this is seen in a disease called as dermatofibroma. So please remember, dimple sign or Fitzpatrick sign is seen in a disease called as dermatofibroma. Seen in dermatofibroma. Moving to the next one. Now this is something which you have definitely seen in your clinic, in the emergency department or something. So can you make a diagnosis just seeing this image? So forget about what I have written on the screen. Now what I want you to see is in this image, which I'm zooming it for you, do you find that there is any rashes on this side of the body? No. So what your eyes should be able to catch here is, this is a patient who is having a unilateral lesion. Okay, this is a unilateral lesion where the lesion is only present over one side of the face, isn't it? Now in this unilateral lesion, what you can find is the patient is having multiple vesicular lesions on a erythematous base. Now, which is the disease where you can find multiple vesicles on an erythematous base on a dermatomal distribution? Any guess? I would prefer to get an answer for this one because this is something very, very common, because all of us, we have got this infection in the childhood. So whenever this infection, there is a reactivation of the virus, that is called as what you see in the screen now. This is the biggest clue I can give you. Excellent. Herpes zoster ophthalmicus. So this is herpes zoster. What you see in the screen right now is called as herpes zoster ophthalmicus. So why do you say this is herpes zoster ophthalmicus? Because there is a very, very important sign here, and the name of this sign is called as Hutchinson sign. So whenever there is a patient who had chickenpox in the childhood, and now there is a reactivation of the chickenpox virus, that is varicella virus, and the patient, when there is a reactivation of varicella virus, they present to you with vesicles on erythematous base on a dermatomal distribution. So when there is a dermatomal distribution, the lesions, they do not cross the midline. They do not cross the midline as well. Now, whenever you get a lesion like this over the face, and if you are able to see that there is a lesion over the tip of the nose. So if there is a lesion somewhere here over the tip of the nose, it means that there is a possibility of the involvement of the eyes. So what do? From dermatology department, we are going to refer this patient. So refer the patient to which department? To ophthalmology, isn't it? To rule out the involvement of the eyes. So just read out this, the name of the sign. A rash on the tip of the nose indicates the involvement of the nasociliary nerve, a branch of ophthalmic nerve. It's a strong predictor of the ocular complication like keratoconjunctivitis and iritis. So whenever there is an involvement of the eyes, how do we know that the eyes can be involved? When you see a vesicle at the tip of the nose. Okay? So that is called as Hutchinson sign. So please remember the sign which is called as Hutchinson sign. So let us learn about some of the signs over the nails as well. Okay, if you see something like this, okay, now what is the finding that you have in this image? So in this image, you can see that there is a lesion, something like this, a oil drop like lesion over a piece of paper, isn't it? So this one is called as oil drop sign. So when you see this kind of a lesion over the nails, then what is this most likely to be? This oil drop sign, this is very specific for psoriasis. So if a patient is having psoriasis, when you examine the nails of the patient, there are a lot of nail changes that you can expect in a patient of psoriasis. A patient can have nail pitting, a patient can have onycholysis, so nail plate dystrophy, different kind of findings. But the most characteristic nail finding that you can see in very good Kalai. This is also called as the salmon appearance. Excellent. So this one is called the most characteristic nail finding in psoriasis. It's called the oil drop sign. Okay, this is called as a oil drop sign. So please remember, this is one of the signs that you can see over the nails. So now let's see one more sign now. Now in this sign, before I read out anything, let me just zoom in this image for you. Okay. Now what I do is, whenever in the OPD, whenever we find any dermatological lesion, the best way to approach dermatological diseases or dermatological conditions is you try to describe the lesion. Okay? So now when I see this image, how do I describe the lesion? What all things do you see here? मुझे ना यहाँ पे एक deep pigmented skin दिख रहा है. Okay. In the center, I can see that the central part is white in color. So there is a deep pigmented skin. Okay, hypopigmentation बोल सकते हो आप, या फिर depigmentation बोल सकते हो, because this area is white in color. Okay, ये जो मैं mark कर रहा हूँ, this area is white in color. This is a deep pigmented skin. Now, just after the deep pigmented skin, if you carefully observe, आपको क्या दिख रहा है? यहाँ पे ना ये जो area है, this area is more darker. This is the tanned skin. Okay, when you go to the sun, there is some tanning, right? So tanned skin or a darker skin I can see. उसके बाद मुझे ना यहाँ पे normal skin भी दिख रहा है. So how many colors do I see in this patient? Central, I see a depigmentation. उसके बाद I can see a hyperpigmentation या फिर एक tanned area. और उसके बाद I can see a normal skin. तो कितना हो गया colors? 3 colors. So 3 colors को the name of the sign will be trichrome sign. So the name of the sign should be trichrome sign. Now the important thing is, in which disease can you see a trichrome sign? So please remember, trichrome sign can be seen in a condition called as vitiligo. So vitiligo is an autoimmune disease where our body is attacking our own cells. So melanocytes get destroyed. There is a complete loss of melanocytes, and because of which we develop a depigmentation of the skin. And in some of the patients, you can see that there is a trichrome sign. Okay, trichrome sign, because when you see the patient, you should always see कि हाँ central में depigmentation है, उसके बाद एक छोटा सा tanned area है, and after that there is a normal skin as well. So all these are various clinical signs that you can see in dermatology. So I have not added too much of clinical signs today because this is the first session of our Medet clinical corner. So when you go through the app also, you can see that there is something called as a clinical corner. So when you go to clinical corner, make sure you start exploring what all things are mentioned in dermatology, because in dermatology we have given you a lot of diseases. जैसे आपका अप्रोच कैसा होना चाहिए if a patient is having acne vulgaris, pimples. How should you approach a patient for psoriasis? How should you approach a patient for different diseases? So what we will do is, there are a lot of things which is given in the app, but along with those, we will also do these kind of sessions where I would be interacting with you directly to explain you कि whenever you are having your dermatology clinics या फिर dermatology posting, be it in internship या be it as a part of your final year MBBS. So what you should do is, we will just try to help you with the approach to a patient in a dermatology clinic so that your understanding becomes better. Okay? So in this today's session, we have covered some of the very important clinical signs, and why eliciting a clinical sign is very important for a physician is, what is the kind of a skill set that you need to develop during your practice is, you should be a very good observer. What others cannot see, you should be able to elicit, because only then with this very good observation skills, you will be able to see, okay, all these are hint of some disease that the patient is having, isn't it? So eliciting the clinical signs is a separate skill by itself, and once you learn about these things, there will be something called as anticipation. So when you anticipate, you see things better, isn't it? So that is how we take it slow into a path of becoming a very good physician. So thank you so much for being an interactive crowd today, and I hope that today's session was helpful to all of you, and I look forward to having a lot of these kind of sessions with you, so that we help you molding you into great physicians or great clinicians of the future. Okay, thank you so much, and we'll be in touch again. And if there is anything, please feel free to get in touch with us. Thank you so much for that.